Hi, I'm going to talk about an interesting case that I happened to see in the clinic today. This 40-year-old lady who presented to me after a cosmetic procedure. She underwent a reduction mastectomy and liposuction 1.5 years back. 6 months later, she started developing small bumps on the site of the procedure, what we call as abscess or pus collection. She was subjected to various tests, one among which was an AFP smear, which turned out to be positive. What is this AFP smear? This AFP smear is a special staining which is used to identify certain bacteria, what we call as a mycobacterium. So the commonest mycobacterium that we know is a Mycobacterium tuberculosis, which causes tuberculosis or TB. So this patient was put on anti-tuberculosis treatment, which she was taking for 4 months, after which she presented to me with no improvement in symptoms and she was developing many more new bumps. So this problem was going on for almost 1.5 years. And why so? Because there was an initial delay in presentation to the doctor. Second, though there was a clue to what was happening, she was unfortunately on a wrong therapy. There are a lot of AFBs that we know. The common, as I said, was Mycobacterium tuberculosis. Leprosy is also a mycobacterium which is AFP positive. And another common entity that we see now is the non-tuberculous mycobacteria, which is the most commonest cause of post-surgical site infections, is also a AFP positive mycobacteria. So probably this lady had non-tuberculous mycobacterial infection, which explains her no response to the anti-TB treatment that she already was on. So what we did, we repeated an MRI on her, which showed multiple sinus tracts at various places where she underwent the liposuction. She was asked to undergo a repeat debridement of the abscess and the active sinus tract, and it was sent for appropriate tests. What are the tests that we generally ask? Yes, we would ask for an AFP smear, but the AFP smear has to be done along with the culture. So the culture gives an idea which mycobacterium is actually causing this problem, so that we can titrate her anti-mycobacterial therapy. And we also sent for histopathology, which generally shows certain granulomas, which gives us a clue to this mycobacterial disease. So she was put on a combination of intravenous and oral antibiotics active against the non-tuberculous mycobacteria. I reviewed her at 2 months and she shows remarkable improvement in her symptoms, and there have been no further abscesses or bumps developing. What we learn from this case is that 1. When you have a problem, consult your doctor immediately. Second, when you are put on therapy, there is no response at the end of 1 month, revisit your doctor. Find out what is the problem, because therapy for mycobacterial diseases is prolonged and needs regular follow-up with your doctors.